We'll see what this looks like from this angle, because I just want to measure internal rotation of the hip by bringing the foot out. Yeah. So yours is actually pretty good side to side. So we want to see external rotation. Whoa. It's a little tighter.
Yeah.
Oh, that's really tight. So for you, it's that right hip that's tight.
Yeah.
For external rotation. So like internal rotation is most people's problems. Yours is external rotation. So way to have that happen. Okay, so we've already tested out on Reese that she has some external rotation issues in her hip. So like this is where sometimes I get this common question of like, my chiropractor told my hips are off. And I wish I could have better of tell you that all chiropractors are the same when they talk about hips. Some are talking about the pelvis, some are talking about the low back. I am talking about the anatomical hip. So the hip goes through flexion, extension, internal and external rotation. What we want to see is like as it's going through there, how the hip is moving. So if the hips are tight, that leads to lower back pain. And typically internal rotation is tight, but Reese gets to be the opposite, which ruins all my video for me. So what we're going to go through here is one of the soft tissue techniques that we use to kind of help stretch that external rotation. So what we want to start working on is getting through here. Usually people can use like a pigeon stretch or some of these 90-90 stretches on their own. Sometimes you just need some good old manual therapy to kind of help break up some either like adhesions or scar tissues or whatever has caused this hip. A lot of times it's compensation through different things. We all have different like hip shapes. So as the hip is shaped, we need to kind of work through that, and it compensates. Our hips aren't equal. Usually one hip is a little deeper or shallower than the other, which leads to some of these things. Foot, right? The body is great. It's not very fragile, so it's able to compensate for a whole bunch of stuff. So sometimes you just have to give it a little bit of a feedback. So what we're trying to do is give it feedback to the brain as we go through this stretch of, hey, get a little bit longer so we can use it. And then we have to use it towards a function of life. So that's where we add in the exercise part. But this is really good for like our golfers, our pickleball players, our tennis players, people that need to get into that back rotation. So if they didn't have that external rotation, they won't be able to rotate as much. So if Reese was into those things, then she would have limitation, which could lead to like lower back pain or knee pain, depending on. But the hip is really important. Just like, you know, Chubb said, it's all in the hips.